This is a professional video that is directed towards or targeting counselors or therapists working with people suffering from mental illness and drug abuse issues. It is referred to as the 12 core functions of the alcohol and other drug abuse counselor. There are 12 core functions. The first one is screening. Under screening, you are expected to, as a therapist or a counselor, you are expected to evaluate psychological, social, physiological signs and symptoms of alcohol and other drug abuse, use and abuse. You are supposed to determine the client's appropriateness for admission or referral, determine the client's eligibility for admission or referral, identify any coexisting condition like medical, psychiatric, physical, etc. that indicate need for additional professional assessment and services, adhere to applicable laws, regulation, and agency policies governing alcohol and other drug abuse services. The next function is the intake. Under the intake, the global criteria is to complete required documents for admission to the program, complete required documents for program eligibility and appropriateness, obtain appropriate signed consent when soliciting from or providing information to outside sources to protect clients' confidentiality and rights, which is like the HIPAA, HIPAA document, consent release of information document. In the case of minors, the legal guardian has to sign the consent to release information. The next item is the orientation. Under orientation, you have to provide overview to the client by describing program goals and objectives for the client care. Provide an overview to the client by describing program rules and client's obligation and rights. Provide an overview to the client of program operations, which might be what days of the week the office is open or services are available, and what hours of the day of operation. The next item is assessment. Under assessment, you are supposed to gather relevant history from clients, including but not limited to alcohol and other drug abuse, using appropriate interview techniques. In this case, it could be motivational interviewing or any other modality. Identify methods and procedures for obtaining corroborative information from significant secondary sources regarding clients' alcohol and other drug abuse and psychosocial history. Identify appropriate assessment tools. What could be ASI, it could be CRAFT, it could be CAGE. Explain to the client the rationale for the use of assessment techniques in order to facilitate understanding. Develop a diagnostic evaluation of the client's substance abuse and any coexisting conditions based on the result of all assessment in order to provide an integrated approach to treatment planning based on the client's strengths, weaknesses, and identified problems and needs. Now we go on to treatment planning. Under treatment planning, you explain assessment results to the client in an understandable manner. You identify and rank problems based on individual client's needs in written treatment plan. Formulate agreed upon immediate and long-term goals using behavioral terms in the written treatment plan. Identify the treatment methods and resources to be used as appropriate for the individual client. Now the next item is counseling. Under counseling, you select the counseling theories that applies. You apply techniques to assist the client, group, and or family in exploring problems and ramifications. Apply techniques to assist the client, group, and or family in examining the client's behavior, attitudes, and or feelings if appropriate in the treatment setting. Individualized counseling in accordance with cultural, gender, and lifestyle differences. Interact with the client in an appropriate therapeutic manner. Elicit solutions and decisions from the client. That is, you interact with the client in such a way as to help the client to actually be able to verbalize and discuss solutions to their own problems, not imposing solutions on the client. Implement the treatment plan. The next item is case management. Usually under case management, you coordinate services for client care. The client might need housing, might need a job, and you explain the rationale of case management activities to the client. In most cases, you try to understand that you treat the client as a whole person, in the sense that you also try to look at other issues that the client might be dealing with and try to provide case management assistance in that case to further help the move the treatment along. The next item is crisis intervention. You recognize the elements of the client's crisis. You implement an immediate course of action appropriate to the crisis. You enhance overall treatment by utilizing crisis events. The next item is the client education. You present relevant alcohol and other drug use abuse information to the client through formal and or informal processes. You present information that are available alcohol and on other drug services and resources. This will help to move the treatment along just in the way that you educate the client. The next item is referral. You identify needs and or problems that the agency and or counselor cannot meet. You explain the rationale for the referral to the client. That is, if your agency is not able to provide certain services to address the needs or the problems of the client, you are bound to refer them out to another agency. Match the client's needs and or problems to appropriate resources. Adhere to applicable laws, regulations, and agency policies governing procedures related to the protection of clients' confidentiality. In that case, if you are going to be referring the client out, you have to take necessary precautions to ensure that the client has consented to you to contact other agencies or other sources for to address their needs. Report and record keeping. Under report and record keeping, I need to add some more things to the referral. Assist the client in utilizing the support system and community resources available. Now we move on to report and record keeping. Charting the result of the assessment and treatment plan, writing reports, progress notes, and so on. Under the report and record keeping, you prepare reports and relevant records, integrating available information to facilitate the continuum of care. Chart pertinent ongoing information pertinent to the client or pertaining to the client. Utilize relevant information from written documents for client care. So the last and the final function is the consultation with other professionals in regard to client treatment and those services. Under this function, you have to recognize issues that are beyond the counselor's base of knowledge and or skill. You consult with appropriate resources to ensure the provision of effective treatment services. You adhere to applicable laws, regulations, and agency policies governing the disclosure of client identifying data. You explain the rationale for the consultation to the client if appropriate. Now that is the whole list of the 12 core functions, which often interlap, and particularly when it comes to assessment and treatment plan, it has to be continuous in the sense that the more you interact with the client, the more you better to know their weaknesses and strength, and then the assessment will change in regard to that. So also would be the treatment plan. If you need additional information and you'd like to read more about this, I will advise that you consult with a professional organization or one of the universities that train or provide or train therapists or provide courses in the subject, and you should be able to pull down a copy of the 12 core functions from many of the universities or therapeutic organizations. Thank you very much for listening.